You might be surprised to know that diabetes can also affect your hearing. According to the American Diabetes Association, the National Institute of Health has found that hearing loss is twice as common in people with diabetes as it is in those who don't have the disease. According to a new study from Henry Ford Hospital in Detroit, having diabetes may cause women to experience a greater degree of hearing loss as they age, especially if their diabetes is poorly controlled. Men had worse hearing loss across the board compared to women in the study, regardless of their age or whether or not they had diabetes. Paige Holt, Doctor of Audiology at Lake ENT, reminds us that other things can contribute to hearing loss as well as diabetes.
There are many different things that can cause hearing loss. The most common would be aging and just degeneration of the hearing nerve. Noise exposure. Men who work in a factory around loud equipment, women can work around loud equipment as well. Family history can play a part, genetics, but we also can see some ototoxicity with certain medications that you take and certain drugs that are taken. Some of them are needed for life-threatening situations, and in those cases the physician who is administering that medication will refer the patient for monitoring to monitor the hearing over time as they take that medication to make sure that they're not losing a lot of the hearing. Hearing loss can be genetically related, and so we always would recommend that if you do have a strong history of hearing loss in your family members, that you do start having your hearing screened in your middle years, because we want to know what your hearing is, a baseline, so that if you do have something happen and you start feeling like you're not hearing very well, my ear feels plugged up, I have some fullness in my ear, I have some ringing in my ear, then we can have a hearing test performed and we will have a baseline to compare it to so that we can determine, is your hearing starting to progress? Is this just an episode that we can treat medically and have it recover? Or are we starting to see some aging? Occasionally we will see someone who has a sudden hearing loss, and there are some ways of treating sudden hearing losses that we might see some recovery. But in general, when you start to see the gradual progression from the aging process, it's not something that we can recover. As aging occurs, there's damage to the hearing nerve. There's no way to stop it from happening. You'll just continue to have a progressive hearing loss over time. The hearing aids will help you hear better. They will not cause further hearing loss, and they will not really prevent further hearing loss.
For more information on hearing aids and the audiology services available at Lake ENT, please click the Diabetic Hearing Loss Story link on our homepage at yourhometownhealth.com.